Lexi, I told you about this. I just asked you, baby, to tell me the truth.
What happens when helplessness and desperation cross? That's what this teen went through when she decided what to do with her baby. The catch is, the baby was found dead. But why? A New Mexico 19-year-old teen named Alexi Treviso was accused of stuffing her newborn baby in the trial, which ended up killing the child. The entire arrest was caught on body cam footage. On January 27th, Alexi gets admitted to an emergency room because of a back pain. She was also asked if she was pregnant, but she always just said no until a pregnancy test came back positive. But when they wanted to inform her, she was nowhere to be found. From a simple pregnancy test to killing an entire child in less than 20 minutes. Her back pain won't be anything bad as to what she has to face in jail. So this is when the ER nurses are called to explain what actually went down.
I was called and to go clean the patient's bathroom in ER around, maybe 2 o'clock or so, I think it was the time, I'm not too sure. So when I went in there, it was a gory, bloody massacre mess.
Could you describe it if possible?
Yeah, there was blood everywhere. There was blood on the floor, on the wall.
Do you remember which wall?
The one behind the toilet, and then the one on the side, right here. You know, there's the one where the toilet sits, back of that.
Yeah.
And then on the side.
Where the call button is?
Yeah.
Okay.
And on the floor, everywhere. It was all over the place, all over the floor, because even when I was going into the bathroom, there was blood on the coming out of the bathroom, on the floor.
Okay.
So it was everywhere.
Okay.
So there's blood coming out of the bathroom? Do you
Yeah,
know how far it
footsteps.
went? Okay.
I think they were the person that was in there, her footsteps.
Not one to go by lightly with such a situation, but surely if she tried hiding something like that, she would have at least cleaned the floors. It's almost as though she accepted her fate in that she'd end up in jail. There even was CCTV camera footage of Alexi running to the washroom and being in there for 19 minutes. People were worried too. Even the mother was seen to calmly go to the bathroom. You'd wonder that the mom would take off running behind her daughter who already was in a lot of pain. Odd, isn't it? They had to bust in because 19 minutes spent in a hospital bathroom is no joke at all.
I knocked on the door and I said, "Are you okay?" And she said, "Yes, I'm fine. I'm just having a hard time going to the bathroom," is what she replied. So I was like, okay.
She said she needed to go have a bowel movement, and that's kind of when the whole thing happened. At some point, I went and kind of checked on her, knocked on the door, seeing if she needed anything. She denied. She said she didn't need anything.
Did you hear anything?
I didn't hear anything.
Toilet flush?
Yes. After a while, I started hearing. So I probably checked on her 2 to 3 times. I'm not exactly sure. And then I just kept hearing paper towel dispenser and flushing and like the water running. And I knocked again. Did she need anything? Denied anything. And then eventually it got to a point where I said, "You need to come out," and I asked the clerk to get the key to unlock the door, because obviously she locked the door to go to the restroom. And whenever we finally had the key to unlock it, she opened it and just kind of walked out.
Did she say anything at that point?
She didn't say anything. She was just looking kind of straight past me and went back to the room.
Only after Alexi had to leave is when it was discovered that the bathroom was filled with blood. That's something you don't want to walk into. The first guess the doctors had was either a miscarriage or that she hurt herself. What happened is actually way much more horrific.
And all I saw was like blood everywhere, like on the walls, on the toilet. It just looked like a horror film.
We didn't know what this blood was from. We were a little concerned that maybe she had, known that we were going to figure it out and that she might have harmed herself or something in the restroom, so the doc wanted to go check her, but obviously that wasn't the case.
She came out of the restroom. There was a little trail of blood from the bathroom back to her room. We went to her room. I went to get her undressed. The doctor came in, explained to her that she had a miscarriage. Her and her mom had a back and forth about it.
The doctor said she had a miscarriage?
Yeah.
Okay.
She said it seems, essentially, like, I'm not sure the exact words, so it was a few months ago, but she said, it seems that you've suffered from a miscarriage, which did seem totally abnormal. I've seen awful miscarriages before that are very bloody.
Right.
And so...
was she bloody?
Mm-hmm. And then there
her
was
legs? And
yeah, she had blood all down her legs, and then there was like blood in the bathroom everywhere. So
Where exactly was the blood and how much?
it was a good amount. It was like on the floor.
The details mentioned in the interrogation is disturbing. It's just disgusting how such a young woman could think this is okay. To kill your own child in the most inhumane way.
When I went to go through the trash, I felt that when I picked up the trash and I looked in it, there was trash in it. But I knew that didn't feel like when I picked it up, it was some weight. So I thought it was the trash bags, because we put the trash bags on the bottom. Mm-hmm. And so I started getting the trash out, and then when I did that, I seen that there was a baby in there. And that's when I freaked out, and I called Lori and HT, or the nurses up front, and because there was a baby in the trash. And the baby, when I looked at it, the baby was wrapped up like in a, like on the bottom of the trash can, and with trash on top of it.
Can you like describe the baby?
Yeah, he was about like that big. He had hair, and he was like purplish, but still not like pink. I don't know how to describe it. He was like, he wasn't bruised or nothing like that, and he was like purple, pink skin type color.
Okay.
How was the bag? How was the bag placed, or what?
It looks like she wrapped it around like that, and then wrapped it like under him, and then put him on the bottom of it.
Okay. And was the baby moving at all?
No.
Okay. Did you touch him at all?
No.
So when I picked it up and I moved it towards the door, I was like, it is heavy. So I pulled it out because it had like a fresh liner inside, so we didn't think nothing of it because we looked. So when I pulled the liner out, there was like paper towels. Then we had rolled trash bags already in there, but she had grabbed a few and like balled them up and put them on top of him. So when I removed them, that's when I noticed the baby on the bottom of the trash can just wrapped in the bag. Like she had it tight, like because it was the top was twisted and then like tucked under, like so it wouldn't open up. And when I picked it up, that's when I noticed it even more, because all I saw was black and purple. But once we picked it up, like the bag suctioned to his face, and that's when I yelled for my charge nurse, which was HT. And I told him, hey, she put her baby in the trash can. So I handed the baby to him, and he took off to the trauma room and opened up the bag, and then that's when we went and got Dr. Vasquez. To me, I mean, it looked like she had given birth in there and was trying to clean it up. Like, it wasn't that much blood on the floor, but you could tell she was cleaning it up because it was like smeared and somewhat cleaned up a little bit. I usually, when there's like one or two things in the wastebasket, I usually pick it up and take it out, but I didn't that night. And then, like, I've been kicking myself on this because I feel like, if I would have just taken it out, I would have seen it.
Well, no one prepares for that type of thing. You know what I mean? Most people don't act like that. So don't blame yourself for it.
Yeah.
Because it's not a natural thing to do.
I mean, it's just hard because I'm a mother, I'm a grandmother, and I've dealt with death before, but never like this.
Right.
Like, it was horrible. The umbilical cord looked like an animal had tore it apart. Like, have you ever eaten string cheese? Like, when you twist it, that's how the bottom of the umbilical cord looked. And I just remember it caught my eye, and I was like, God. I was like, this chick really ripped this thing apart. I mean, that's just something I'm never going to forget.
Right.
The doctors and nurses tried to save the newborn, but they understood it was pointless as it already sadly passed away. Truly, this is heartbreaking.
So I saw the baby in there, so I pulled the baby out, got him on the bed, checked for signs of life. There was absolutely no life whatsoever. I immediately came out of there. After I did that, went into the room where she was performing the vaginal exam, and I immediately told her, you have to come out now. And she came out, and we went into trauma 2, and she reassessed the baby. At that time, between me and Chris and her, we determined, there was no reason for us to begin any life saving. The baby was completely gone.
The news was broken to the mom, who was completely shocked. Who wouldn't be after learning that her own daughter delivered a child in a bathroom with no medical help. And that too, the child is not even with them.
We discovered a dead baby in the bathroom. Oh my gosh.
I'm sorry. It came out of me and I didn't know what to do.
Lexi, I told you about this.
But it
I just asked you, baby, to tell me the truth.
it was not crying or nothing.
What did you do to it?
Okay, stop right here.
I
Stop,
just
stop.
couldn't-
Number one priority, guys. Number one priority is she just had a baby. I don't know if she's delivered the placenta. She's bleeding significantly.
Yeah.
I've spoken to the obstetrician at Loveless. They want her out there as soon as possible. I'm sorry about this, but in terms of delivering a baby and it looked like you tried to hide it, we do have to have the police involved.
And nothing was crying. It came out with nothing.
I know. But the baby's gonna have to be taken for autopsy and there'll be an investigator and everything.
The mother was stunned to know that her daughter kept her entire full-term pregnancy a secret. On top of that, killing the child? What an explosion of emotions.
Do you guys have, I'm the charge nurse here, do you guys have any questions for me?
Like, how big is the baby?
It's full term.
What?
Nothing,
9 months?
nothing was crying.
Lexi, have you watched the news of the girls that what they do to their babies and what they go to jail?
Nothing was crying.
Where did you put the baby at? Tell me the truth.
When we got in there,
Where did you put the baby at?
517-836-460.
That came out in the toilet bag?
it was crying.
You put it in the bag?
Yes.
Yeah,
In what bag?
in the trash bag.
Why did you say anything to us? Do you want to get in trouble for this now? You could get in trouble for
Mom,
this baby.
Mom, alright, just give it time, okay?
She essentially was scared. She was worried that she was going to get in trouble. She did have the back and forth with her mother that was just about like, they had said, oh, the mom was upset because she had had sex and hadn't told her. So they were going back and forth on that, and then she was just denying it, which was a little out of the, wasn't really deniable at that point in time.
Right.
So the patient was denying having sex at this point to her mom.
Yeah, she was trying to state that she was still a virgin.
After she came in from the bathroom.
It seemed like she'd been trying to hide this pregnancy from her mother for some time. So if you know you're pregnant, you're not going to continue taking birth control pills. But if you're trying to hide it, you might start taking weight loss medications. That's just kind of what it seemed like in my head.
It just seemed like we were being just deceived from the beginning, like, but that's just my take on it. It seemed like she was very manipulative with us, and it was at least what it seemed like to me. She didn't want you to discover, that she was pregnant, and she wore really baggy clothing. And she wouldn't sit still for you. I'm sure she was very uncomfortable too, but yeah, she wouldn't allow you to do it.
To claim that you're a virgin after delivering a whole child is just beyond imagination. I mean, how did she think babies were made? And how did she even assume that the mother would fall for it? What's shocking is that an entire ultrasound was taken as well. It's borderline pathetic to deny such claims when there is literal medical history. Guess some people just don't understand how logic works.
I didn't want to have a conversation with her after I was given this information. But she was talking to me, and while I'm trying to get things set up, and she says, I don't know what's going on. She said, I didn't know I was pregnant. I'm a cheerleader. I started gaining a lot of weight. My clothes were tight. I was taking birth control pills. So she said, this didn't make any sense to me. I don't know what to tell you. And I did my scan, and then I left. She panics because when she was talking to me, she was talking pretty rapid, and she was like, I don't understand. So, was it all mental, psychological, who knows, but she definitely knew what she was doing, and what was doing was wrong because of the way she was talking to me, just stating, I didn't realize I was pregnant, and, but I'm taking birth control, so, she was panicked, but, I didn't see her being in a state of mind where she did not know what she was doing.
The doctor then described the emotions Alexi felt, which, may I add, was nothing. She probably had this entire thing planned, if that would have been her reaction.
I went in there to talk to the patient and asked her why was the baby in the trash can.
And what did she say?
She said that it just came out of her and she didn't know what to do.
Did they have any comments?
Not one.
Really?
I was really surprised. Not one person asked me about the baby, if it was alive, if it was dead, if it was a boy, if it was a girl. No one asked me anything. Not even, she didn't even ask. No, she didn't ask. The only thing she started doing was crying and started talking about she didn't know what to do. Not one. I've never seen I've delivered multiple babies and I've seen multiple miscarriages and I've never seen a reaction like that. And I don't even know what to say about that. I've never seen anything like it in my life.
How would you describe the reaction?
I think there was no emotion except for herself, and she really wasn't even crying tears. She was just, and the only thing she was upset about was that I think she was going to be in trouble with her mother. I'm just going to tell you this: I've never ever seen a reaction like that girl. I don't even know what to say about it. There was zero emotion. I don't even know what to say. I've never seen anything like it. I've seen women that are only married, or not married, but pregnant for 6 weeks and they lose that baby and they're a mess. You know what I mean? That girl went in that bathroom, made no sounds at all, and the baby came out of her. And had, I don't even know how she functioned that way, to do what she did and with no emotion. I've never seen anything like it.
And it was a pretty good sized baby. Pretty good size.
It looked term to me.
Yeah, me too.
I mean, it was term. I can't tell you that was, but the only thing that upsets me the most is I understand she was scared, and I think her mother had a big dynamic on her, and I understand that. I mean, I think her mother was probably pretty controlling. I don't know that. I'm just speculation. But she gave me no chance to save that baby. I had no chance, and that's not what I do. My job is to save lives, and I had no chance on that baby. She gave me no chance. And we are a facility that you can drop the baby off, no questions asked. You can just leave the baby and go. I don't care, as long as you bring the baby to a safe. We are one of those type of hospitals, so it's hard to fathom what was going on in her mind. I don't know. I've never seen anything like that, and I pray to God I never see it again.
Alexi was asked to sign a paper that gave permission since she was being transported to another hospital via helicopter.
This is for the flight crew is going to transfer you to that facility, so just sign the date. Today's the 27th. They'll be here for her in 30 minutes.
Well,
They're going to transfer her in 30 minutes.
okay, I'll let them know. Okay, thank you.
Hey, Lexi, so you're getting transported, okay? So you're not detained no more. The detectives will be contacting you, okay? So they'll get a hold of you. So let me get your street number real quick.
My mom has it.
Okay, your current street address?
Yes, sir.
Okay. All right, they'll be in contact with you, okay?
Yes, sir.
The father of the now deceased child is present, and the police speak to Rosa, Alexi's mom, to tell her about the updates.
What's going to happen with her,
So she's going to get treatment before we even talk to her because she needs to be stabilized. So that's why she didn't let it out.
okay?
Once she gets stabilized, we'll try and talk to her. The baby's going to go up north for autopsy. More likely it will be done within the next day.
Is she gonna get detained after, she's released? How?
Get what?
Are y'all gonna take her to custody or anything like that?
That depends on what the DA finds. We have to wait for the autopsy to come back to see what happened. Because right now with how everything happened, we're gonna do an investigation, get more information from the OMI, Office of Medical Investigator up north. And with that, we present that to DA, see what the DA wants to do with charges, if any at all.
Okay. Okay. So they already took her out.
No, she's getting life flight. She's right now being set up to go to the...
What happens?
What do you mean?
Before the DA makes a decision or that?
It should be pretty soon they make a decision. Because with the age of the decedent, they usually expedite autopsy reports and such. With normal people that pass naturally at home, it takes a couple months for us to get reports back. Stuff like this, we'll get it back pretty soon.
Okay.
So
Still more, they don't know.
They
we
don't know yet, babe.
we don't know. That's why he'll be going up north. Has y'all's information been taken yet?
He took my driver's license. He took her driver's license.
Okay.
My phone number. My phone number. Yeah.
So, even though she's of age, if she's not available to be contacted, can we put you down as next of kin for all my? Okay. And you'd be grandmother?
I'm mom.
So you'd be
I'm
the
her mom.
you'd be the descendant's grandmother.
Yes.
Okay. Just wanted to make sure.
So that's her boyfriend.
Mr. Boyfriend, do you have a driver's license? Okay. And is the address on you current? On the driver's license? Okay. Because determining on what the OMI does, if she's still in medical, and they do release the infant back, it'll have to be released somebody. That'll be up to OMI who they determine next of kin is. Maybe the parents, but maybe you, okay? So that's why we're going to get everyone's information.
The police asked her about why they're in the hospital, along with the death of her grandson. She also reveals her traumatic past that justified why Alexi has had back problems since she was a child.
Would y'all mind talking to me later when y'all are okay?
Yeah, I was with her. I know she talked to him for a while on the phone, and then she came to me, so I've been with her the rest of the time.
Today? Oh. So what did she come here for that she told you?
She told me she had back pain.
That's it?
That's it.
Okay. Has she been having back pain before?
Yeah, pain for her and her hips is no, I mean, she was born with like I don't know, it's like crooked.
Her spine?
Okay, because my ex-husband, he hit me. He beat me whenever I was pregnant with her. So she was early. So she had some problems with her hips. Like I always had to take her to the chiropractor to get adjusted because she couldn't use it. Like she was always getting constipated. Like she had to get lined up, whatever. So I mean, I've been taking her to chiropractor because I always thought, this time, I didn't know. I honestly didn't know she was pregnant. I didn't know. I just thought, like she said, I have back pain. Mom, my hips are hurting me. I think I need to go to the chiropractor. I said, okay, let's go tomorrow. But she was like in really a lot of pain, and
When did it start?
Like the pain?
Yes.
Yesterday she said it was really bad, that her hips were hurting and her back. And then last night we're on the phone together and she said her hips were hurting bad. I asked her if anything else was hurting, and she said just everything. And she went to sleep.
An odd reaction when he's asked if he's the father. Seriously, to laugh? Especially when the father of the child has zero emotions and the ladies seem to not care? But that wasn't the end to the nightmare, because 4 months later, the police came back knocking on Alexi's door, and the entire process was not done easily or quickly since her mother retaliated.
What is she under arrest for? No, I'm not bringing her out here yet. Let me know what she's under arrest for.
She's gonna get arrested regardless, ma'am. I mean, I don't know why.
For what? For what? For what?
Are you okay with telling
Yeah, go ahead.
Tell me.
Homicide. Open count of homicide. And tampering with evidence.
Tampering with evidence?
Yes.
At the hospital?
Yes.
Can I see the warrant?
It's an arrest warrant for her. It's
Okay,
not a
can I
search
see the
warrant for your
arrest warrant?
house.
I want to see the arrest warrant.
And what will that prove?
You bet when this is over, I'm coming for the police department and the hospital.
Yes.
I am.
Yes, ma'am.
Why is the mother shocked for why her daughter is getting arrested? Is she dumb enough to not understand what the literal medical report said? To be this ignorant just to save your own blood is not at all justified. And to even throw a mild threat in does not make the situation any better. But oh well. The mother eventually gives in since she has no real and valid reason to say no, but cries to them to handle her gently. Pretty big ask for someone who killed their own child.
That is his policy.
I will give it to you. Please don't. Please don't.
He ran away from 1002 West Washington.
It's nothing personal. It really isn't. And we understand. But we have to do our jobs too. Okay?
I understand that.
I understand
that.
Who's this?
That's Melanie. That's Devin's mom. She's good. She's okay.
We're not going to be rough with her or anything. We're just going to take her over there and book her.
Please don't be rough with her, please.
Just bring her out. You can be with her the entire time. Okay?
Do you know where the public safety complex is? 3300 West Main?
You can follow us over there.
Alexi could grab what she needed. She was then put in handcuffs and taken to the hospital. Even during this whole situation, Alexi was just emotionless while her mother was just crying. Not because of killing the child, but because her daughter is being put in handcuffs. Alexi deserves it. Alexi was handed a thick set of papers of their complaints and the further investigations that needed to be done. Orange is definitely her color. Alexi was charged with first-degree murder and tampering with evidence in the second degree. But it's also sad when we find out that she's not in jail. Whatever her lawyer is doing is somehow working. It's just a very scary contrast that her mother showed more emotion during that time of Alexi's arrest than when she found out about the dead child. How Alexi would rather kill a child than openly admit to her mother about her pregnancy. It's also sad that the people who grieved the most over the child are the hospital staff. Alexi still claims that she has done nothing wrong, even after all the evidence is given. She may have escaped severe punishment, but the world knows of the cruel treatment she's given to the baby boy without a name. What do you think of this case? If you found this video informative, please like, share, and subscribe to stay updated on this and other important issues. Let's continue the conversation and push for positive change. Stay safe, stay informed, and see you in the next video.